The supermarket chain Shoprite has asked government to allow its workers to be next in line to get vaccines. It says it has 140,000 workers. Together, they serve over 25 million people every month. There's some research which appears to show that cashiers are more exposed than many other people to the virus. And I should say at this point that Shoprite has actually offered to pay for their staff to get vaccinated. Well, we're joined now by Professor Pieter Engelbrecht, Professor of Sociology at the University of Johannesburg, and Dr. Azar Jammine, the Chief Economist at Econometrics. Good afternoon to you both. Dr. Jammine, let me start with you. There's a really interesting argument here. We expect mining companies, for example, to protect their workers. If a mining company set someone underground without a hard hat, there'll be trouble. I imagine Shoprite could make the same case. Our cashiers should be vaccinated against COVID-19.
Very much so, and in fact there has been a lot of criticism that all the focus had been leveled at providing vaccinations to healthcare workers and to teachers, and not to cashiers who are in very close contact with the public at large, people that they don't know from a bar of soap all the time, and therefore are vulnerable to contracting the virus in every way as much as teachers or nurses are, for example.
There's a really interesting conversation as well around the duty, the legal duty that a company has to its employees. We do expect something of companies when it comes to their workers.
Without a doubt, I think it's incumbent on companies to be concerned in that regard and to protect their workers. And to this extent, one welcomes the move by the likes of Shoprite to actually be more proactive in that regard and not just sit back. As you know, with many of us, we can sit in our lounges at home, our offices at home, and not be subjected to the risks of contracting the virus. But that doesn't apply to so many of the other professions that are exposed and that are performing a very critical duty. Not everyone can go and shop online and not go to supermarkets. The majority still are compelled to do so, and therefore the people that respond to them, the tellers and the shop assistants, are themselves extremely vulnerable.
There's another whole complicated economic argument. So I'm not going to say anything against vaccinating teachers at this stage, although if I was a police union, I might be slightly upset. But you could argue, I suppose, that people who are in the workplace who keep the economy going are vital because of the role that they serve in taking income home to their families. You could argue that to keep the economy going, these are the kind of people you need to vaccinate in particular sectors. So it wouldn't just be cashiers, it would be petrol pump attendants, for example.
Yes, and far more than petrol pump attendants. In fact, there's a whole list that one could probably do. So I don't know where one draws the line. It's obviously interest groups are pressing for their own members to be the first in line, and that's the kind of result that you end up getting. It has to be very well organized.
I mean, and related to all of this, we all know that the economy is only going to start recovering properly if vaccinations work and when most people are vaccinated. And we know from the evidence vaccinations do work.
The evidence thus far has shown that certainly internationally, the rate of growth in economies such as the United States and Britain took off once the vaccination process began. What we are unclear of, obviously, from a longer-term point of view, is whether the fact that people are being vaccinated now ensures a long-term immunity to these viruses. What we are starting to see that is creating a little more nervousness is that in countries where vaccinations have been undertaken in a big way, that in itself is starting to breed the outcrop of new variants that are starting to raise infections in a new way once more. And this can potentially, it's a black swan event that may just turn around to bite the international economy, and we could get some nasty surprises in that regard. But for the moment, the evidence points to, from a short-term point of view, means more vaccinations, greater economic activity.
We're joined now by Professor Pieter Engelbrecht, Professor of Sociology at the University of Johannesburg. Professor Engelbrecht, I mean, there's a huge conversation around, for want of a better phrase, I'll call it the vaccine queue. Who gets vaccinated when? You could argue that no big company should be able to sort of get advantage by vaccinating its people. And at the same time, if I was Shoprite, I would say, well, my cashiers, unfortunately, I can't pay very much. I can protect them. They are at risk, and therefore, I want to vaccinate them.
Yes, indeed, and good afternoon, Stephen. Look, I think the big problem here is that there isn't a generally agreed set of principles which help us to determine the prioritisation. This does exist in a number of other countries, and we have to have this, otherwise it's not possible to determine the merits of shop workers against teachers, against soldiers, against journalists. So we have to have a set of principles. And I think what's been adopted elsewhere is that this needs to be based upon the potential for saving lives. And of course, along with that then goes ensuring that there are as few hospitalizations as possible. And there may well be economic arguments that go into that. If the economy goes into freefall, maybe it will lead to further deaths. But the key thing is we need to have an agreement on prioritisation. Now, if I may just come to the question of shop workers, since you've raised that specifically, I would have much more sympathy for some of these big owners of supermarkets if they took greater care of their own shop workers, their cashiers and so on. And I had a report just last night, in fact, from a major supermarket in the middle of Soweto. I won't say which owner. And the concern there was that there'd been an infection, and then the workers were expected to come back the next day without any proper testing. Now, that is dangerous. It's dangerous to the shop workers themselves, and it's dangerous for the people who use that shop. So if we're going to go along with what the owners are saying, then there has to be a set of responsibilities on their behalf as well. And to be honest, I would much rather we had a government elected by the population making the decisions about the prioritisation. Now, we might have criticisms of the government, and I certainly have very many of them, but I wouldn't like these things to be left to business interest, because they'll always be fighting with each other, one supermarket against another, one mine against another, and so forth. That's the nature of capitalism. So we have to have a set of agreed principles for the whole of South Africa. And the President must take a lead in that regard, rather than continuing with this lack of transparency that we have at the moment.
I mean, there's so many different ways of looking at it, Professor, and I'm completely with you on the set of principles, and I'm going to come to a little bit of where the government's undermined its own legitimacy in a moment. But if, for example, one principle could be, and I think this would be perfectly justifiable, we're going to vaccinate the people who are most vulnerable first. So that would be what government's done. People who are over the age of 60, I didn't call them elderly, people over the age of 60. Then you could say, well, people with comorbidities. As an example, off the top of my head, people living with diabetes. That would be one way to approach it. If I were an epidemiologist, and I'm not, or perhaps strictly amateur status, you could argue that, well, taxi drivers are super spreaders through no fault of their own, but through their work, and therefore we should vaccinate them first. I mean, that's quite a set of principles that one could argue about, and yet you're making, I think, a much bigger point, that we haven't even had that argument, and yet both of those things are some things we should look at.
Yes, indeed, and this is the problem that arises if you don't have an underlying principle. And it may well be that there's a good case to be made for taxi drivers, but how do we know? I mean, I'm sympathetic to taxi drivers, I'm sympathetic to teachers, I'm sympathetic to shop workers, and so forth. I'm actually sympathetic to the police at the moment, and one could certainly put forward a case for saying that it's very important that order is maintained. And what we've seen in some places is that the police are having to go into quarantine themselves, and this means that people can't get service at the police station. So there's a whole lot of arguments that could be made, and I think we need to make sure that there is proper advice given to the government. We don't know how they're determining the priorities. We don't know for sure whether these decisions are all being made in cabinet, but we can assume that they are, and we don't know on the basis of what advice they're getting. And in general terms, my own view is that to the extent that there is formal advice from ministerial advisory committees, it comes purely from people with a medical background. We do have an MAC responsible for social and behavioural change, but it doesn't have academics on it like the other two MACs do. it's mainly, overwhelmingly dominated by people from churches. Now, I'm sure they're very good people and they provide some good information. But what we need to do now is to professionalize what's going on in the domain of social and behavioral change. And if we've got a set of principles, then we can make sure there is evidence on each of the different cases.
Azar Jammine, in a way, all of this is driven by scarcity, and this is sort of an economic argument as well. If the scarcity goes away, in other words, the number of vaccine doses improves dramatically, this entire argument goes away, and it removes what could be a very difficult argument for our society.
Well, it will go away.
I'm sorry, Professor, it's for Azar Jammine. Azar?
Sorry. You're absolutely correct in saying that it's a case of supply. What we've seen, surely we can learn from the experiences of overseas countries that have been vaccinating large chunks of their entire populations as to how they prioritizing the rollout of that. And a lot of that has to do, I think, with the ready availability of the vaccines. The other issue, obviously, that stands in the way is the administrative capability of the system in different ways. Should one go prioritize a certain section of workers when the administrative capability of vaccinating those workers is inferior to another set where we may think that vaccination is not a priority, but where it's very easy to vaccinate them? Again, the resolution to that is dependent on the availability of vaccines more generally. But the actual administrative and logistical rollout of vaccines is also a very important issue to take into consideration.
Professor Alexander, I mean, there's a lot going on around vaccines at the moment. We talk to the scientists all the time. You're an expert on sociology. Is there any particular issue at this stage that's really worrying you, that's keeping you awake at night when you look at our society through all of this?
Well, yes, there certainly is. And one of them is this question of the distribution of vaccines. Clearly, we have a major problem internationally. We now have 12-year-olds being vaccinated in Canada, but people who are very, very vulnerable in South Africa not getting the vaccine. So there's a whole problem there with the world system. Within South Africa, there is prioritization going on in practice towards wealthier middle-class people, amongst the insured, 48% had been vaccinated by the end of about a week ago, and only 26% of people who are uninsured. In other words, the poorer people in society. And that's something we have to address. And if we don't, then we're going to have the scale of problem from below magnified. And this is really what concerns me. When I'm in meetings at the moment, what I listen to is anger and despair. And the thing there that worries me more than anything is the despair. Because when people despair, they stop practicing social distancing and wearing of masks, so everybody becomes more vulnerable. The families of those people, they themselves, and society more generally. And part of that despair comes from the fact that people are very, very hungry. And we have to address that as a matter of urgency. The social relief of distress grant has to be brought back, and has to be brought back preferably at a higher level. It's not something that we can avoid and we can brush it off and say that we don't have the resources. Of course we have the resources in South Africa. My rough estimate is that if we had 10 million people every month being given a social relief of distress grant, and if it was increased to about 400 Rand, it would cost us only about 4 billion Rand. And in terms of the overall spending of the government, that's not a large amount of money, and it would save thousands of lives. The last thing we want is despair. The last thing we need is cynicism about what the government is doing, because that will undermine the whole process of vaccination and of protecting lives.
Professor Pieter Alexander, Professor of Sociology at the University of Johannesburg, Azar Jammine, thank you very much indeed. He's the Chief Economist at Econometrics. An important conversation.